Hi IR friends, it's Stephanie. This video is created for medical students and residents preparing for their interventional radiology rotation. The purpose of this video is to introduce you to basic items on the IR back table. Understanding and helping manage the back table is a really important step in learning procedures and demonstrating that you're a part of the team. So let's get started. The Interventional Radiology back table is a sterile table where we prepare and store various devices needed for our procedures. Here's an example setup. Please note that there are different packs that may vary depending on the manufacturer and the various procedure needs that you have. Most trays have this plastic bowl or two. They're designed to hold sterile saline inside, which can be used to flush devices during a procedure. You might use the syringe, for example. It also has a little shelving right here that will hold your wire in place should you choose to use it to store wires during the procedure. And generally, you want to try to keep the saline in these buckets clean. That's just good form. A lot of procedures, you'll see this device right here. It's called a manifold. It's something that you can screw on your saline syringe to. And then this is a place where you can actually withdraw clean saline into the syringe that hasn't been contaminated by blood clots. This is really important during endovascular procedures when you are injecting materials directly into blood vessels. So good form to use this if you're in the middle of a vascular procedure. Other cups, you might find these little cups. Oops. Like this saline cup and this specimen cup. They're often used to hold medications, such as lidocaine. Specimen cups you can also use to hold things like contrast or little doodads that you might find on the table as such. This is a waste bucket where you can deposit liquid waste. There are a lot of variations on the appearance, but the premise is overall the same. The idea is that there's a small little hole where you can inject waste fluids directly into. It's really nice because this plastic shielding right here prevents any fluid from bouncing back at you and spraying you, which is preferred, of course. If you look inside, they actually have some absorbent material to help hold that fluid. As a trainee, at the end of the case, something you can do is make sure you put the lid on top of the waste bucket so that it doesn't spill and it's ready to go to the trash. Something else that's important is the sharps container. It's made out of plastic on this outside and it's got foam in the inside where you can stick your needles and other sharps into. It's really, really important to be fastidious about your sharps. That's how you keep yourself safe as well as your teammates. Speaking of sharps, most kits come with this device, which is an 11 blade. Most of them are protected by a plastic cover. You can see you can just slide it back to reveal the blade. These blades are nice and sharp and pointy. That's because in IR, we're making really small incisions that are precise. That's the nature of an endovascular procedure. When you're done using it, you could either slide it off as such. Often I'll just stick it into the sharps container to keep it safe. Also, in terms of sharps, needles come in different sizes and different colors, as you can see here. The blue needle is the smaller of the two. You can imagine this is a really small needle that can be used for injecting things under the skin, such as lidocaine. Put that there. All right, on the table you also have, various syringe sizes. Generally the most commonly found sizes are the 10 and the 20 ml syringes, as you can see here. Technically, all your syringes should be labeled with a label. That's really important so people can know what's in it. It could be contrast, heparin, lidocaine, all sorts of things that you might put in here. Keep in mind that different institutions also have different preferences for what goes in each syringe, so always pay attention to the labels when you're using them. Okay, and then we have our metal tools right here. So there's typically 3 metal tools that you find on each tray. The first is pretty obvious, right? This is the scissors. That's pretty much all I have to say about that. Second, you have 2 clamps. The difference between these clamps is pretty much as follows. If you look, one of them has a straight tip, one of them has a curved tip. And they have different uses. Both can be used to be clamping different things. This one is also useful as a needle driver when you want to suture. The hemostat, because it has that curved directional tip, you can use to dissect into small spaces in a directional fashion. So those are your tools. And then finally, a few other things. Here, of course, is your 4x4 gauze, which you may recognize from surgery. It's nice and soft. You can use it to wipe things, dress things, all sorts of things. You'll also see some blue towels as well. This is used primarily for draping the patient, but it's handy for holding things in place, wiping, things like that as well. And finally, usually you'll see a chlorhexidine stick on the table. This is what sterilizes the skin. Most of them have some kind of color. This one happens to be blue. A lot of them happen to be orange or clear. So that's usually on your tables as well. All right, that about sums it up for basics on the IR back table. Hope that really helps, and I look forward to seeing you on your IR rotation.